I would like to thank Chairman Cummings and Ranking Member Jordan and the committee for giving me the opportunity today to share my frontline experience. I am the nurse director of the Berkeley-Morgan County Board of Health. I cover Berkeley County, which is the second largest county in West Virginia of about 118,000. And then a neighboring county of Morgan is a smaller county of about 18,000. So I have a good perspective on rural and urban. I'm an Robert Wood Johnson public health nurse leader. There are 25 of us in the nation. My state is hemorrhaging, and without long-term funding and commitment and plan, we will continue to bleed. We are appreciative of the funding that we are getting, but we need infrastructure support. To this date, none of the SOAR money has hit the community level. I've not seen one penny. In March, I was asked to put an order in for naloxone. Our state has the highest number of overdoses in the country. I've yet to see one dose of that naloxone from the $1 million that's at the state level for it that was supposed to cover from March of this year to March of next year. I'm getting good local support. Our county commission and our city commission has supported us and helped me get a harm reduction program up and running in Berkeley County before the state had funding from the federal level or any guidelines on it. Our Medicaid expansion has been crucial. Before that, we were unable to link people to care. However, it still has many gaps. Providers won't accept it, and those who do, it creates a financial burden because they're 3 to 4 months getting reimbursement. There's huge gaps in the MAT. We have more providers trying to get waived, but a lot of our providers are very leery because it requires a waiver, but OxyContin and Percocet doesn't require them a waiver to prescribe. And when you get them linked to MAT, it doesn't stop there. I get a couple to MAT, they give me a call and say, I hate to bother you, you've helped me so much, but I can't get my prescription because I don't have a valid ID. So I meet them at the pharmacy and use my personal ID so they can get their medications, and then link them to nonprofits that will help them get through the process of getting their ID. The tentacles of this crisis and epidemic reach every level of our community. And with what we know about the adverse childhood experiences, we are perpetuating generations of addiction and substance use disorder. In President Trump's State of the Union address, he said that there was a plan to end domestic HIV within the next 10 years. I literally responded back to the TV and said, not an attainable goal with the way we are addressing the opioid epidemic. West Virginia has always been a low-incidence state for HIV, and we have 52 new cases in Huntington, West Virginia right now, all linked to injection drug use. My colleague explained and gave an analogy of substance use disorder, the best I've ever heard it. Imagine a carousel spinning around. We offer support before people enter by prevention and trying to prevent our children from first drug use. We offer support at the end when people need recovery, although there's much more work that needs to be done. But as you're spinning out of control and you're the most vulnerable, we do not intervene at all. And that's where in harm reduction programs with syringe access can intervene and are vitally important of reducing the spread of disease such as HIV, hepatitis A, B, and C, and other things such as endocarditis, abscesses, that's costing our healthcare dollars billions. Those who do not learn from history are doomed to repeat it, so said President Roosevelt. Have we not learned from the HIV and AIDS epidemic that's slow to respond and putting the money and the funding and the resources where it's needed? It does work. Ryan Waite has proven that. I support this CARE Act to help heal our communities and give the actual funding that's needed to address substance use disorder and mental health in our country. Communities are letting their morality and lack of education get in the way of harm reduction programs and syringe access. I was raised Pentecostal, and I remember my Bible stories from when Jesus walked this earth. And when he did not seek the rich and the kings and the queens. He sought the poor. He sought out the leopard, those of disease, and the prostitutes. And I have no doubt today that if Jesus walked this earth right now, he would be working alongside me in harm reduction clinics because I do God's work every day. And so does the staff, my small staff, that works so hard to help accomplish that. This is very personal to me because our state has been riveted, and we've lost our family members, people we went to high school with, our children. You can see the data, and it's very important. But beyond the numbers, at the local level, we see the faces every day. I would like to invite you. I'm not far away from you, less than 2 hours. Come visit my clinic, see what the front lines look like. Arrange a meeting that you can sit down with the 30+ community partners that we meet and work and try to manipulate the systems and the barriers to get people help. We need force multipliers. There's not enough of us. We need real infrastructure. And I'm sure that's why the SOAR money hasn't even touched the community level yet. They're just floundering at the state level, and we are at the community level too. Besides myself, there are 2 other nurses that are trying to do this for 118,000 population. We need help, and I'm asking you please to support this CARE Act and give the real funding that's needed to address substance use disorder and mental health in this country. I hear people say, well, don't you just think you gotta wait for this generation to die out before the opioid epidemic will be over? And my response is, which generation? I'm seeing 3 now and more are coming on every day. Our children being born right now in West Virginia are at a high risk of having substance use disorder because of the zip code that they live in. How sad is that? I have a great niece who's 1.5 years old who is just the joy of my family. And I want to change this before she gets to middle school and becomes at higher risk. Thank you for the opportunity for me to speak today, and please do the right thing for the people who are suffering in my state as well as others.
Thank you very much.